Hello, world and universe. Welcome to the Trevor Donald Experience. Manifest your truth. And if you're new to the channel, please hit that like and subscribe button. And for all my continued followers, I want to say thank you. And this is an opinion-based video channel where I try to open your eyes and ears up to some of the travails and tribulations that take place throughout our cities, our states, our country, and sometimes around the world. And this particular story has everything to do with our healthcare system. And what are some of the pillars to a healthy society? Well, we need a healthy school system for our children. We need a healthy public safety department, such as our police department, our fire department. And of course, we need a healthy healthcare system. Our hospitals need to be in great shape, along with other ancillary services like grocery stores and things of that nature. Well, if you look over the last 10 or 15 years, there's been a lot of urgent cares that have popped up. As we all know, for lower income and especially people of color who do not go to the doctor or their personal physicians, internal medicine, or primary care on a regular basis, they end up in emergency rooms. And that has put a heavy burden on our healthcare system. So as an ancillary service, urgent cares have started popping up, which have been a great service. It has lessened the burden on our emergency room systems. And now you have a secondary place that you can go to get looked at, definitely if it's for a minor circumstance. And of course, our hospitals are definitely there for something that is major. So urgent cares play a major part in the health and welfare of our society. Well, just as we have this particular healthcare system with urgent care, sometimes fraud can rear its ugly head. And I have a story about a doctor out of St. Louis, Missouri, who allegedly owned 2 urgent cares and got caught up in Medicaid and Medicare fraud. So let's get into it. This is where possibly egregiousness and greed overstepped his boundary of being a healthcare provider for helping and healing. Sounds like this was a pay-for-play situation. So let's go. St. Louis area doctor sentenced for healthcare fraud. U.S. District Judge Stephen R. Clark sentenced a doctor who ran 2 urgent care centers in the St. Louis area to 35 months in prison for defrauding Medicare and Missouri Medicaid, and ordered him to pay $742,528. Dr. Sonny Saggar, 57, will also be on supervised release for 3 years after he leaves prison. So what happened with Dr. Saggar? Saggar pleaded guilty in U.S. District Court in St. Louis in August to 1 count of conspiracy. He admitted that while operating St. Louis General Hospital, SLGH, locations in downtown St. Louis and near Creve Coeur, he and his office manager hired physician assistants, PAs, to see patients but billed Medicare and Missouri Medicaid as if Dr. Saggar had seen them, even when he was out of town. Physician assistants are medical school graduates who have not completed a residency program. To legally practice medicine in Missouri, they are required to be closely supervised and monitored by a licensed physician under written collaborative practice arrangements called CPAs, collaborative practice arrangements, CPAs, that restrict the physician assistant's ability to provide medical services and limit their practice areas to medically underserved rural or urban areas. So you're not going to see this situation with PAs out in Creve Coeur, Chesterfield, or Ladue. Makes you wonder why these PAs are being supervised by these physicians. Why are they using these PAs to get their training in urban and in rural areas for poor people? Are they using poor people and in rural and urban areas as test dummies. Why aren't these physician assistants being supervised in the suburbs? Makes you question that in and of itself. Dr. Saggar admitted hiring numerous PAs from July 2018 to July 2023 to work at the SLGA, the St. Louis General Hospital locations, which he and office manager Renita Behringer advertised as both urgent and primary care facilities and as a residency prep program and a stepping stone for the physician assistants. That's what I just said. Dr. Saggar admitted that PAs, physician assistants, were not properly trained or supervised, and that he and Behringer advised them to consult each other on their medical questions. One physician can legally supervise no more than 6 physician assistants. So Dr. Saggar offers stipends of up to $480 per month to various physicians to induce them to sign up to collaborating physicians, and then submitted CPA forms to the Missouri Board of Registration for the Healing Arts to falsely make it appear as if the physician assistants were being properly supervised. He admitted that the Creve Coeur location is not a medically underserved area, and thus physician assistants are not permitted to work there in his Creve Coeur office. Now remember, there's a socioeconomic difference between downtown St. Louis and Creve Coeur. Finally, Dr. Saggar admitted that in January 2022, he hired a doctor who had been indicted in another case to be the sole collaborating physician at the Creve Coeur location, but did not disclose to Medicaid that the co-conspirator was performing services there. So that's fraudulent. And that physician was under investigation. That physician's billing privileges with Medicaid had been suspended. The conduct of Dr. Saggar and Ms. Behringer caused a loss to Medicare and Missouri Medicaid of up to $742,528. Today's sentencing underscores our commitment to ensuring that providers are held accountable for submitting fraudulent claims for financial gain and for deliberately concealing critical information about healthcare professionals, said Special Agent in Charge Linda T. Hanley of the U.S. Department of Health and Human Services Office of the Inspector General, HHS-OIG. HHS-OIG, in partnership with the U.S. Attorney's Office and other law enforcement agencies, will continue working together to safeguard the integrity of the Medicare and Medicaid programs. This crime went beyond bilking taxpayer-funded healthcare programs. Dr. Sonny Saggar risked the well-being of patients with urgent care medical needs. He knew his physician assistants were not qualified to see patients without supervision, said Special Agent in Charge Ashley Johnson of the FBI St. Louis Division. To add further insult to injury, Dr. Saggar falsely claimed he was the one who saw the patient so he could bill Medicaid and Medicare. In order for doctors to bill them, they have to be the one seeing them. Doctors are expected to follow a certain code of conduct and obey the laws and regulations put in place to protect their clients. DEA St. Louis Division Special Agent in Charge Michael Davis said, "Our investigation shows that Dr. Saggar broke with protocol and endangered lives with his negligence. As a result of his misconduct, he was arrested, surrendered his DEA certification of registration, and can no longer prescribe controlled substances and faces nearly 3 years in federal prison." Ms. Behringer, 51, pleaded guilty in December to 1 count of conspiracy. She is scheduled to be sentenced on April 22nd of this year. Now, just listen to this. Just as you notice that this doctor, under these allegations um, of Medicaid and Missouri Medicaid and Medicare fraud, but look at all the agencies that came in to investigate them. This is where I think sometimes when people are trying to sneak and commit crimes, they're not realizing how big this web can be. So the U.S. Department of Health and Human Services Office of Inspector General investigated the FBI, the Drug Enforcement Administration, the DEA, and the Missouri Attorney General's Medicaid Fraud Control Unit investigated this case. Assistant U.S. Attorney Amy Sestrick is prosecuting the case. So look at all of these divisions that are involved in this particular case based on this Medicaid fraud of about $800,000. And don't forget, the IRS is going to be involved in that also. So that's just the food for thought if you're deciding to, as a healthcare professional, possibly commit Medicare and Medicaid fraud. There are going to be a lot of alphabet agencies coming after you. And the surprising note about this, when these doctors get in trouble for Medicare and Medicaid fraud, when you look at the entire paradigm of healthcare billing, whether you have an indemnity plan like Blue Cross Blue Shield, a PPO plan, a HMO plan, they kind of step down from there, Medicaid, and then let alone Medicare, which is for people who are on disability or if you're 65 and over. Medicaid and Medicare pay the least out to physicians. So when you see all of these doctors that are getting in trouble for Medicare and Medicaid fraud, they're getting the least amount of pay from those two particular entities. But what doctors, physicians are failing to realize, they probably have the biggest oversight and auditing of all of the insurance departments or companies. So Medicaid and Medicare may pay the least, but you have all these eyeballs on Medicare and Medicaid reimbursements, and you have all these eyeballs and all of these healthcare departments, state departments and federal departments that are watching physicians and their billing habits to make sure that they're doing the right thing. So these doctors that are committing these kinds of crimes on Medicaid and Medicare fraud, they're going to get the minimal amount of payment, but they can get the maximum amount of criminal penalty if they commit that crime. So it's not like if they committed insurance fraud with Blue Cross Blue Shield or Cigna, you're getting premium payment, which would fit the crime if you get caught. But in Medicare and Medicaid, they pay less, but you're still going to get the maximum amount of criminal penalty for that kind of insurance fraud. So you got this kind of duality that goes on in these particular situations. But you see a lot of doctors that get in trouble for Medicare and Medicaid fraud all the time. Tell me what you think about this case on this gentleman who owned two urgent cares that we see all over throughout many of our major cities in our country that have popped up over recent years. And he allegedly had two of them, and greediness and greed got the best of him. And now he got his hand caught in the cookie jar, and it looks like he's going to be serving some federal prison time. This has been the Trevor Donald Experience. Manifest your truth.